Hello students, after covering pharmacology of penicillins, in this video we are going to study pharmacology of cephalosporins. So what are cephalosporins? What is their mechanism of action, their classification, their antibacterial spectrum, clinical uses and adverse effects? All this we are going to cover in this video. Now cephalosporins are antibiotics. Antibiotics are a class of drugs which are used to treat bacterial infections. Now, cephalosporins belong to the second major group of beta-lactam antibiotics after penicillins. So, like penicillins, cephalosporins also kill bacteria and are thus bactericidal. Now, cephalosporin was obtained from the fungus Cephalosporium acrimonium. Now, however, the present major source of cephalosporin is cephalosporin C. Now, all clinically used cephalosporins are semi-synthetic antibiotics derived from cephalosporin C. Now, look at this structure. This is the structure of cephalosporin nucleus. It consists of a beta-lactam ring that is fused to a dihydrothiazine ring. Now, by addition of different side chains at position 7 of beta-lactam ring and at position 3 of dihydrothiazine ring, a large number of semi-synthetic compounds have been produced. Now, let's review once again what is beta-lactamase. Now, beta-lactamase is a group of enzymes which are produced by some bacteria. Now, these enzymes break the beta-lactam ring of beta-lactam antibiotics. Now, as the beta-lactam ring breaks, the beta-lactam antibiotic loses its antibacterial activity and it becomes ineffective and can no more destroy the bacteria. So, by producing beta-lactamase enzyme, the bacteria tries to develop resistance to the effect of beta-lactam antibiotics. Unlike penicillins, cephalosporins are resistant to beta-lactamase. Now, most beta-lactamases cannot break beta-lactam ring of cephalosporins. Now, let's understand mechanism of action of beta-lactam antibiotics. Now, all beta-lactam antibiotics, including cephalosporins, inhibit synthesis of bacterial cell wall, and this results in cell death. Now, look at the structure of gram-positive and gram-negative bacteria. Now, gram-positive bacteria have a very thick peptidoglycan cell wall made up of multiple layers, while in gram-negative bacteria, peptidoglycan cell wall is thin and it is also surrounded by an outer membrane made up of lipopolysaccharides. Now, look at this figure. This is a peptidoglycan layer or a chain, and this is another peptidoglycan layer. Now, these peptidoglycan layers are made up of two types of sugars, N-acetylmuramic acid, in short NAM, and N-acetylglucosamine, in short NAC. Now, a pentapeptide chain made up of 5 amino acids is attached to each NAM sugar. Now, pentapeptide chain of one peptidoglycan layer is cross-linked with the pentapeptide chain of another peptidoglycan layer, and this cross-linking provides strength and stability to the cell wall of bacteria. Now, penicillin binding proteins shown here in the yellow color are enzymes that are responsible for cross-linking these pentapeptide chains. Now, these penicillin binding proteins, they break terminal amino acid of a pentapeptide chain, and the energy released is utilized for the formation of new peptide bonds and cross-linking. Now, cephalosporins bind to such penicillin binding proteins and irreversibly block them or irreversibly inhibit them. Now, this prevents transpeptidation and cross-linking between the peptidoglycan layers. So this prevents synthesis of bacterial cell wall, and cell wall deficient bacteria are produced. Now this causes increased passage of fluids inside the bacterial cells, and therefore the bacteria swells and finally it bursts. That is, the cell breaks, it undergoes lysis, resulting in cell death. And thus cephalosporins, they exhibit bactericidal action, and they are used in treating bacterial infections. Now, this is a classification of cephalosporins. Cephalosporins are grouped into 5 generations based on their antibacterial spectrum and time of invention. Some preparations are given orally while others are administered parenterally. Now, first generation oral drugs are cephalexin, cefadroxil, while cefazolin is administered parenterally. Now, first generation cephalosporins have high activity against gram-positive but weak activity against gram-negative bacteria. Then, second generation cephalosporins, these were developed subsequent to first generation drugs and are less active against gram-positive but more active against gram-negative when compared to first generation. Now, cefaclor, cefproxil are given orally. Cefuroxime is used both orally and parenterally, while cefoxetine is administered parenterally. Now, cefaclor and cefuroxime are also active against anaerobic bacteria. Now, third generation cephalosporins are the least active against gram-positive, but these drugs exhibit enhanced activity against gram-negative bacteria compared to first and the second generation. Now, oral drugs include cefixime, cipodoxime, cefdinir, ceftibuten, cefamet, while parenteral drugs are cefotaxime, ceftriaxone, ceftriaxone, ceftazidime, and cefoperazone. Now, these drugs are also active against anaerobic bacteria. Now, cefepime, a parenteral cephalosporin, is included in the fourth generation. It is more potent against gram-positive and also against gram-negative than the third generation. Now, very important, it has maximum activity amongst all cephalosporins for gram-negative bacteria. Then ceftaroline. Ceftaroline is a parenteral 5th generation cephalosporin. It has maximum activity against gram-positive bacteria. Now, very important, it is the only cephalosporin that is active against resistant strains like methicillin resistant Staphylococcus aureus, Listeria monocytogenes, Enterococcus facilis. Now, it has good activity against gram-negative bacteria also. Now, as we move from first generation onwards, there is increase in activity against gram-negative bacteria. Now, third generation cephalosporins are the most commonly used for gram-negative infections. Then the fourth generation cephalosporin, that is cefepime, exhibit excellent activity against gram-negative bacteria. And this drug is reserved for severe infections like hospital-acquired pneumonia, septicemia. Now, 5th generation ceftaroline is the only cephalosporin that is active against resistant gram-positive strains like methicillin resistant Staphylococcus aureus. So, after classification, let's study the antimicrobial spectrum of cephalosporins. Now, all cephalosporins are inactive against atypical bacteria. These are the bacteria with no cell wall, and these include chlamydia, mycoplasma, legionella. Now look at this chart. This chart beautifully summarizes antibacterial spectrum and clinical uses of all generations of cephalosporins. Now, first generation cephalosporins, they exhibit high activity against gram-positive bacteria, primarily staphylococci and streptococci. Now, very important to understand that 90% of staphylococci produce beta-lactamase. Now this beta-lactamase breaks the beta-lactam ring. So none of the penicillins except methicillin class of penicillin is active against beta-lactamase producing staphylococci, and thus these bacteria are called as methicillin sensitive Staphylococcus aureus, in short MSSA. So first generation cephalosporins are active against methicillin sensitive Staphylococcus aureus as well as streptococci. So these drugs are used as an alternative to penicillin. Now, in addition to this, these drugs also exhibit weak activity against some gram-negative bacteria like Proteus mirabilis, E. coli, Klebsiella pneumonia. So, these first generation cephalosporins are used as an alternative to penicillins for infections like ear, nose and throat infections, ENT infections, then upper respiratory tract infections, skin and soft tissue infections. In addition to this, cefazolin parenterally is used as a prophylactic against surgical infections. So, this is in brief antibacterial spectrum and clinical uses of first generation of cephalosporins. Now second generation cephalosporins, these have less activity against gram-positive but more active against gram-negative bacteria compared to first generation. Now utility of these drugs has been declined and more of third generation cephalosporins are used for gram-negative infections. However, cefuroxime is often used to treat respiratory infections like community acquired bronchitis, CAP, then community acquired pneumonia, that is CAP. Other indications are infections like urinary and soft tissue infections caused by gram-negative bacteria. Now, in addition to this, cefuroxime, cefaclor are effective against anaerobic bacteria. So, cefuroxime, cefaclor are also used in mixed aerobic anaerobic infections like for example in cancer patients, in patients undergoing colorectal surgery, etc. Now these patients can get infected by aerobic as well as anaerobic bacteria. So these are the clinical uses of second generation cephalosporins. Now talking about the third generation cephalosporins are the least active of all cephalosporins against gram-positive bacteria. However, they show very high, excellent activity against gram-negative bacteria. And these are effective against extended gram-negative spectrum and are also resistant to beta-lactamases produced by gram-negative bacteria. Then ceftazidime and cefoperazone, these also show activity against Pseudomonas. Now, in addition to this, these third generation cephalosporins, they are also effective against anaerobic bacteria. So, third generation cephalosporins are the preferred choice and these are the most frequently used antibiotics for the treatment of gram-negative infections. So, indications include respiratory, urinary and soft tissue infections caused by gram-negative bacteria. Then, ceftriaxone or cefotaxime are used in the treatment of meningitis. Then, ceftazidime is most effective for Pseudomonas meningitis. Then, ceftriaxone is the first choice drug for the treatment of gonorrhea. Then ceftriaxone and cefoperazone, these are preferred for the treatment of typhoid fever. Now as these drugs are effective against anaerobes, these are also used in the treatment of mixed aerobic anaerobic infections. Now, they can also be used for hospital-acquired infections, especially respiratory and other infections in the intensive care unit. Then ceftazidime or other third generation cephalosporin can be used in the prophylaxis as well as in the treatment of infections in neutropenic patients, either alone or in combination with other antibiotics. So this is in brief on the bacterial spectrum and clinical uses of third generation cephalosporins. Now, fourth generation cephalosporin, that is a parenteral cephipene, exhibit high activity against gram-positive bacteria, similar to first generation cephalosporin. And these are effective against methicillin-sensitive Staphylococcus aureus as well as streptococci. So, activity is similar to that of first generation cephalosporins. Now, very important, cephipene exhibits highest activity amongst all cephalosporins against gram-negative bacteria. It's effective against extended gram-negative spectrum, and it is also highly resistant to beta-lactamase produced by gram-negative bacteria. In addition to this, it is also active against Pseudomonas. So this drug, that is cephipene, is reserved for serious and resistant infections like hospital-acquired pneumonia, then febrile neutropenia, bacteremia, septicemia. Now coming to the fifth generation. Now fifth generation cephalosporin, that is parenteral ceftaroline, has highest activity against all cephalosporins and beta-lactam antibiotics against resistant strains of gram-positive bacteria. It's highly effective against methicillin-resistant Staphylococcus aureus. None of the beta-lactam antibiotics is active against this bacteria. Now, it is also active against Listeria monocytogenes and Enterococcus facialis. So, in addition to these resistant strains of gram-positive bacteria, ceftaroline also exhibits high activity against extended spectrum of gram-negative bacteria, but it is not effective against Pseudomonas. So, ceftaroline is used for the treatment of methicillin-resistant Staphylococcus aureus infection. Now, ceftaroline is also effective against resistant Streptococcus pneumonia. So, ceftaroline is used in the treatment of hospital-acquired pneumonia and community-acquired pneumonia. So, in summary, first generation cephalosporins are used as an alternative to penicillins. Third generation cephalosporins are excellent and are commonly prescribed for gram-negative infections. Then fourth generation cephalosporin, that is the parenteral cephipene, is reserved for serious infections like hospital-acquired infections. Then fifth generation cephalosporin, that is the parenteral ceftaroline, is a broad spectrum antibiotic effective against resistant strains. So this is an overview of antibacterial spectrum and clinical uses of cephalosporins. Now let's talk in brief on adverse effects of cephalosporins. Now hypersensitivity reactions. These reactions are the most important adverse effects of cephalosporins. Now common manifestations or common symptoms include rashes, then hives, a type of allergic skin rash, swelling. Now in addition to this, anaphylaxis, which can be very severe, angioedema, that is swelling under the skin, wheezing, that is difficulty in breathing, and urticaria, that is itchy skin rashes, can also occur. Now very important, incidences of cephalosporin induced hypersensitivity reactions are lower than those with the penicillins. Now, 10% of patients allergic to penicillin show cross-reactivity to cephalosporins. That means out of 100 patients allergic to penicillins, around 10 patients will show allergy towards cephalosporins also. So, there is a cross-reactivity between penicillins and cephalosporins. Then cefotetin and ceftriaxone these drugs can bind to red blood cells of the patients, and this can induce synthesis of antibodies, and the antibodies synthesized can break the red blood cells, resulting in drug induced immune hemolytic anemia. Now, in addition to this, consumption of alcohol with cefamandole, then cefoperazone can cause disulfiram-like reactions. Now, cephalosporins like cefoperazole, then ceftriaxone can cause vitamin K deficiency, resulting in reduced synthesis of clotting factor prothrombin. This causes hypoprothrombemia, and this results in the bleeding. Now, some cephalosporins have low-grade nephrotoxicity, which can be increased due to pre-existing renal disease, then due to concurrent administration of aminoglycosides or loop diuretics. Now, cephalosporins, as we know, are broad-spectrum antibiotics, and they can cause diarrhea due to disturbance or due to alteration of healthy gut microbial flora. Now, in neonates, ceftriaxone is contraindicated as it can cause hyperbilirubinemia. So, it is very essential to keep a watch for the occurrence of adverse effects when the patient is on cephalosporins. So, this is in brief on pharmacology of cephalosporins. Please note, information provided in this video is meant only for academic informative purpose. For use of cephalosporins or for the treatment of infection, consult your physicians. Now, very important, antibiotics should never be consumed without consultation with the physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.